The COVID-19 pandemic has now killed roughly 200,000 people in the United States, more than any other country in the world. According to Johns Hopkins University, more than 6.8 million Americans have tested positive for the virus. Meanwhile, the CDC is again backtracking on some of its previous guidance. This time, it's over how the virus spreads. Mola Lenghi has more.
Confusion tonight from the CDC after official guidance posted Friday said airborne transmission is the primary way the virus is spread. And there is growing evidence that droplets and airborne particles can remain suspended in the air and be breathed in by others and travel distances beyond 6 feet. But in a sudden reversal today, the CDC removed that guidance, saying in an email to CBS News when asked why, the bottom line is airborne transmission is possible, but not the main way that it spreads.
It may not be the main way it spreads, but there's good evidence that the virus can spread through the air under certain circumstances at distances greater than 6 feet.
Meanwhile, the bells at the National Cathedral tolled 200 times on Sunday as the U.S. nears 200,000 lives lost to the virus, including Rebecca Luper's father, Fred.
I held his hand and I told him I loved him and I put my head on his chest. My mom was there and we each took turns going and saying goodbye to him.
Luper's daughter called her father's death needless. Well, adding to the sense of confusion is the fact that it's been months since the CDC or the White House Coronavirus Task Force have briefed the American public. But Elaine, health officials stress to keep social distancing and keep wearing your masks.
For more on the CDC's guidelines, let's bring in Dr. Joseph Mosquera. He's a general practitioner with over 35 years of experience and a medical expert for RXSaver. Dr. Mosquera, thanks very much for being with us. Does this sudden change raise red flags for you?
Not really. This is about the third revision of the CDC in a constantly evolving new virus that we're trying to understand. One thing for sure is, as you mentioned in your previous segment, most of the transmissions occur within 6 feet because of respiratory droplets. These droplets are heavy. They certainly don't travel more than 6 feet. However, in poorly ventilated areas, when people are speaking loudly, when they're sneezing, they're coughing, it is possible for aerosolized droplets to travel further. That's the exception rather than the rule, but that also may redefine how we want to think of indoor activities in schools and having the proper ventilation and precautions.
That was going to be my next question. What does this mean for the public? Does this change how we should be protecting ourselves?
I think the masks and distancing right now are essential, but we can improve, particularly in areas of ventilation indoors when there's indoor activities. Limiting perhaps expanding the 6-foot rule in some circumstances where there's poor ventilation. So that's going to be the key, is spacing when there's poor ventilation and indoor activities. Outdoors, I think the 6-foot rule is still something very good to keep. However, indoors, as we just don't know enough about this virus and its aerosolized spread, when there's a so-called super spreader indoors and singing in a choir or at a function, that is still unknown, and you can have some aerolized travel. Doctors and epidemiologists and scientists all over the country are still studying these matters.
Well, the World Health Organization updated its guidance for aerosols months ago after hundreds of scientists raised the alarm. Should the CDC be faster in following their lead?
Well, the CDC's done quite a bit in organizing guidance for schools, for hospitals, for doctors. They have a lot on their plate, and there's going to be revisions. This is their third major revision. But I think they should follow the science closely, which I'm sure they are. And I think they're going to have special instructions for certain activities, especially indoor activities, where that 6-foot distancing requires additional precautionary measures, and in particular, ventilation measures.
Well, last week, the CDC walked back guidance on testing, guidance that reportedly came from HHS officials and was posted to the agency's website without scientific review. So this certainly raises an issue when it comes to public trust. Can the public feel confident in information coming out of the nation's primary health protection agency?
I am in touch with the CDC all the time. I follow their guidances. They've been a great agency for so many years. They're a vital guide to our public health, the most vital guide. I would say they've done, the World Health Organization has to deal with, of course, the world in a lot of other ways, but the CDC is our go-to agency here in America to really follow the guidelines. This is an evolving issue with a lot of science that's constantly being debated, but they're really doing well in terms of staying with the proper guidances. So yes, I think the public should have complete trust in the CDC.
Dr. Joseph Mosquera, thank you very much, Doctor.
Welcome.